cardioversion, then that we'll discuss in the treatment of what? Ventricular fib, right? But what really happens in these kind of situations, right? Secondly, another intravenous drug you can choose. For example, if cardioversion apparatus is not there, either you do DC, direct current DC, cardioversion to save the patient life, or if you don't have that option, you can use intravenous procainamide. Procainamide inhibits the bundle of Kent. It slows the conduction and increases the refractory period. So you can use intravenous procainamide, right? That will abort the situation. But you cannot use here, which you should not do the Vagal maneuver. You should not use the IV adenosine. You should not use the digoxin. You should not use the verapamil, right? You should not use the drugs which normally inhibit the AV node and do not inhibit the bundle of Kent. Here you need to use the drug to inhibit the bundle of Kent. And once the patient is out of acute situation, then either in these patients you give antiarrhythmic drugs for a long time, or better, there should be radio frequency catheter ablation. Do you have any question?
Different between Dr. Najeeb's and Google's doctor. Dr. Najeeb says in his lectures, don't give Vagal manoeuvre technique. Here is in Google, Google says give Vagal manoeuvre. One difference. And medication, Dr. Najeeb says don't give adenosines. Google says give adenosines. Like this, an injection of medication such as adenosine can be given in hospital if Vagal manoeuvre don't help. It can block the abnormal electrical signals in your heart. And cardioversions, a type of electrical shock therapy that jolt the heart back into a normal rhythms that may be carried out in hospital if AV treatment doesn't work. There is a difference between Dr. Najeeb with Google's doctor. I find that different between them, but I am confused to study further books for that reasons.